I'm still taking my 15 minutes, I'm sorry. And it was great to meet the students who, of course, are the future. I get a little nervous when I lecture, so I'm going to take a little break here. No laughs, huh? What would you say if I did that? You would say I'm crazy. That's very, very bad for your health. When you look back on this, some of the things that we do today are even crazier. So this is who I am. This is my start. I don't smoke, of course. I think it's a known cause of cancer, poor health, etc. But some of the things that are happening outside of you that you guys could help, okay, are going to seem ridiculous 10 or 20 years from now that we didn't do anything about it. You guys are going to be engineers, hopefully, in the medical field, God willing, and hopefully you can make these changes. So I think do I got to do something for the next slide? Oh, sorry. Sorry, it's not working. Should I do something for the next slide? All right, excellent. I always ask, who is the deadliest animal in the world? And I gave you the answer, okay? It's a little off of my time. If you get the clicker working, it's great. But I'm going to tell you the deadliest animal, of course, is humans. We kill more people than anybody else. But the second most is the mosquito. Can we come up with something to stop mosquitoes, right? All you hear when you come to Thailand is put on bug spray, put on better clothing, etc. And we really haven't made any, we made some advances, but not as many as we would like. So hopefully that's a call to arms for you guys. All right, I think I got to do, hey, can you help me with this is not working. Can I just give you like a little click or something like that? All right, awesome. So what is happening with everything? I want to say global warming. If you say global warming in the United States, people will say that's a bad word. There's people that don't believe in global warming. Of course, I do. But we're going to say environmental impact of humans. Okay? And one of the things we see is with these extreme weathers is heat illness, the air quality. And air quality, if you look at parts per million of what's in the air, has made it to the list of known carcinogens. Things that are known to cause cancer is me with my fake cigarette today. Well, not the fake one, the real one. But smoking has been known to cause cancer. Now, pollution has been known to cause cancer. So we always make the joke is that what kills you the most? It's your neighborhood, right? So the city you live in, the location you live in, has the biggest impact on your health. Okay? And then also we have these new things with water quality, and all infections. Food supply. I think in the United States, many of us don't worry about where we're going to get our next meal. There are some people that have difficulty with finances, maybe homelessness, etc. But for much of the world, food insecurity causes a big problem. And I hear that, it upsets me. But then I hear what happens along with that is all of the psychiatric impact of that, i.e. they get PTSD, they get anxiety, etc. So one of the biggest impacts on global warming and all this environmental changes is your head, is your mind, okay? So it causes lots of mental health illness. So I'm going to give you the next slide. Excellent, excellent, it's working. Okay, so global climate shift, there's new diseases. Every year now, all of the diseases that we saw in the southern hemisphere or towards the equator are moving north, okay? And why? Because we're getting warmer and warmer and warmer. Next slide. Can I just do this? All right, sorry. So mosquitoes are the deadliest animals on Earth. They kill over 1 million people per year, okay? More than sharks, snakes, spiders. And in fact, if you go to the United States, there's shows on Shark Week. And you watch these shows on the Discovery Channel. When you watch them on the Discovery Channel, it doesn't work. Sorry. It is? Okay, I'm sorry. I'm going to start over. No, I'm kidding. I'm kidding. Freaking out. All right. So dengue cases have increased 400 times globally. You guys know more about dengue than I do. You know more about malaria than I do. All right. Oh, it's working. Sorry. So this is the average temperature of the Earth from the 1880s, and we see that the surface temperature rises and rises. I don't know about you, but I'm not a mathematician, but it seems like it's going up. And if that was my stock portfolio, I'd be very, very happy. All right. So what happens here? I'm going to teach you a new disease, and some of them are related to ticks. So do you guys have ticks here? We have lots of ticks in the United States. They used to just be many of them in the southern hemisphere, etc., but now they're moving north, and people are getting very, very excited about it in a negative way. When we think about Lyme disease, have you guys heard of Lyme disease? We have that in the United States. You probably don't see it that much. But have you heard of this alpha-gal syndrome? Now, you hear this alpha-gal, and you think alpha-girl, etc. But actually, it's an enzyme deficiency that women, some women particularly have, that is associated with an allergy, and the allergy is to red meat. So believe it or not, we've seen much increase in this. So I am minding my own business. I am a woman right now for a second, if we could imagine that, and all of a sudden I eat steak. And I go home and I have shortness of breath, hives, abdominal pain. If I have that, it's pretty obvious that I have an allergic reaction, but many of them feel weak, tired, malaise, and it's secondary to this enzyme deficiency. And this enzyme deficiency is very fascinating, but more and more cases are being reported as a disease like babesiosis. So this is a busy slide, but this shows you that malaria, yellow fever, dengue are moving. They're on the move and they're taking over. They're moving north, south, wherever they weren't before. Thank you for fixing this. This is a problem where I live. I live in the southwest United States. Okay, in the southwest United States, we have a disease called valley fever. Valley fever comes from a fungus. I don't know if you guys have that here, but if you had it, it would be in places like the desert, for example. Anyway, it's in the desert. The fungi is in the desert. And when you make a new house, when you move the dust, the dirt, etc., all of a sudden this pops up in the air, and it can cause many diseases. When I talk about coxomycotes, I say it is the great masquerader. That means in English that it can present anyway. Usually presents with lung findings, shortness of breath, chest pain, pneumonia, and that's even difficult to find. But many times it presents with skin findings. So here's a gentleman who had it on his face. He went to dozens of dermatologists and doctors, etc., and then somebody figured out that it was actually a fungal infection and put him on an antifungal. So very bad disease. It's moving all over. It used to just be in the Southwest. Now it's moving towards Canada. All right. You guys know about foodborne illness. You know about the risk factors with water. Everybody's afraid to, drink water in certain countries. We take it for granted. In some countries, you could pop open the faucet and drink. Other places can't. Why can't you guys figure out something for me, like a urine dipstick that'll tell me if the water is safe to drink or not? Can you do that for me? That's your project for the afternoon. All right. Heat stroke is occurring more and more commonly. Okay, you guys probably know about this. This is my emergency department in Phoenix, Arizona. In Phoenix, Arizona, last year we had 702 heat-related deaths. That's a lot of deaths. We had 67,000 emergency department visits for heat-related illness. The key to not getting heat-related illness is to avoid the heat. No duh. And a lot of that happens by getting better housing, better air conditioning, better protection from the sun, etc., and staying hydrated. Okay? And this is one of the things we do. I want to say this is something that we started, a project that we started. And this is one of my colleagues, Dr. Komp. I'm giving him prompts there. We take these things that look like body bags. In fact, when we started, they were body bags where you carry dead people in because they're non-permeable. Water can't go through them. And we fill them up with ice. We fill them up with ice and we cool them rapidly. Now, this doesn't work for everybody. Most people with heat-related illness just need to come in from the heat, go in the shade, drink some water, and they're usually okay. But many people are unconscious, comatose. And I work in the emergency department, and I had many patients come in a couple days in a row who had a temperature of 107, 107, 107. And I said, oh my God, what a coincidence. I should go play the lottery and pick numbers 107. And it turns out that's only as high as our thermometers go. If you want to know more accurately, there's other better thermometers or so. And some of those people are reaching temperatures of 103, 110 or so. Now, that's Fahrenheit, so to convert it over, those are temperatures of 44 degrees Celsius. Okay? And it doesn't take long for you to fry an egg, and it doesn't take long for you to fry a brain cell. Within 4 minutes, if your temperature is hitting that high, you'll have permanent brain damage. All right, so air quality. One of the things I'd like the engineers to do is help us with the air quality. Particulate matter in the air makes everything worse. Okay? It makes asthma worse, heart disease worse. It's also a known carcinogen. I don't have the answers. I can tell you the problem. Now, if a patient of mine tells me, every time I go outside, my asthma gets worse when the high pollution days, and I tell them, don't go outside, I wish there was a better solution. Now, is there a way for you guys to do something simple, maybe an app to tell them that, or maybe stop the pollution at its source? So we know the problems, but we have to figure out an engineering solution to stop it. This is airborne toxin from wildfires, and you can see over the last year, we saw when these levels hit super, super high levels, we mapped them across. I guess the only good place to live is in Greenland, I guess, to be safe from all of these wildfires causing all of this problem. And this is a slide over time. When you get these particulate matters that are greater than 2.5 ppm, particulate matter size, you see the trend is to go up. You get more and more days that are in the blue, which means that it's much more likely to cause cancer, etc. This is another example of not a comic book, but this is an animal. Well, anyone know what this is? Now, you look at it on the side, it's adorable, it's gorgeous. We should have a stuffed animal made out of it. But it turns out that this is a parasite. Nalgeria, have you guys heard of this? So very, very fascinating. It stays in very, very warm climates in lakes. So it's where water is not moving a lot. And it used to be just a problem in Central America. Now it's even made it all the way up to Canada in the last few decades. So I'm not exciting you. I showed you the picture. Well, you go swimming, having a good day going swimming, you hop in the lake. This parasite goes through your nose, hangs out in your brain, and then before you know it, you die from it, okay? And the symptoms are, headache. Who doesn't have a headache every once in a while? Who doesn't have a little bit of nausea? All right, so this is a brain-eating amoeba. Obviously, the best way to prevent it is to detect it. I wish there was a way before I went into the lake, you could put a dipstick in there and tell me if there are amoebas in there. Well, you can't, right? Unfortunately. Hurricanes and flooding, we all know about this, I guess, right? You guys see lots of floodings, lots of hurricanes, etc. And we see a shift with infectious disease going north. This is also about groundwater toxicity and cancer clusters. And I'm not going to go over all of these, but just to tell you that when you get this flooding and groundwater contaminations, a lot of the problems in the sewers, etc., make it into your drinking water, make it onto your vegetables, etc., make it into your food. Make it into the food chain line and supply. I don't know about this, and I could give you a whole lecture on this about microplastics, okay? It turns out that on average, we eat 5 grams of plastic a day, okay? So for those of you guys who have a credit card, that's equivalent to eating a credit card a day of plastics, okay? In fact, they did biopsies on people who had Alzheimer's disease. Now, this is a newer study. I don't know if it's real or not. It's just probably causal. And they found that on average, they had 7 grams of plastic in their brain, okay, versus people who didn't have Alzheimer's. Maybe there's something related. All I'm going to say is I don't think having a credit card and a half of plastic in my brain is going to be good for me. So here are some examples of flooding in this part of the world. And I talked a little bit about the mental health sequelae, about PTSD, substance use, and anxiety, and food insecurity, where that can be leading to mental issues, etc. What does the World Health Organization say? 3 main objectives. It says promote actions that reduce both carbon emissions and improve health. How can we do that? That's for you to come up with. I have some ideas I'm going to give you at the end. Build better climate-resistant and environmentally sustainable healthcare systems. And finally, protect health with a wide range of impacts of climate change. All of this stuff is something that they probably put in ChatGPT and said, hey, what can we do? I mean, give me something hard. And I looked long and hard to try to do this. So here's what I suggest that you guys could do, okay, before you guys become doctors, okay? I'm picking on this table here, okay? Sorry, you came here just for a fun field trip from the Philippines, and now I'm giving you a job to do. Sorry. How about there's an AI predictor of climate change and when it's going to lead to clinical impact? Is there something that does that? Can you tell us? Can you tell the doctors? Can you tell, public health physicians, public health providers, etc.? Can you make the hospital systems more climate resistant or ready for all these changes? Can we protect mental health? Well, I can tell you something. Anytime there's a climate disaster, anytime there's a problem, we can tell you that people are going to have more mental health issues. We can also tell you there's food insecurity. Well, there's one thing that all of you guys did today. Maybe you didn't all shower, maybe you didn't all eat breakfast or have coffee, but I guarantee you guys all looked on your cell phone. So why can't you set up a text message to all these people in these rural areas when there's a disaster to say, how are you feeling? And they say, I'm feeling good. Well, I'm not feeling good. I'm a little depressed. How depressed are you? Well, I'm suicidal. Wouldn't that be a time for you to intervene rather than go to the emergency department or, God forbid, when it's too late? Okay? I wish that I could take something and see if something's drinkable. Is there a solution you guys have for me? I want to be able to not put iodine in my water, not have to boil it for 2 minutes and then be able to drink it. I want you to give me a strip to say, hey, this is safe to drink. And I want you to send that message on an app or connect it to my my phone via Bluetooth. That's my buzzer telling me I have to. We have to educate for the future, of course. When you saw me smoke in the beginning, you said, that's ridiculous. What kind of person would start smoking right now? No offense to anybody that smokes. You got to tell the little kids that the climate is affecting all of these things, infectious disease, bugs, moving north, etc. It's affecting your drinking water, etc. And the easy one, hopefully, is to expand digital care or telehealth for disaster zones. So as a quick message to end, okay, I have practiced in the United States mainly, but I also practice in Syria. And people say, you're such a liar, you're not a Syrian doctor. Well, it turns out that they were bombing hospitals there, and they got groups of doctors to do telehealth. So here I was in my lovely home in the United States, and I was looking at people with wounds in Syria through telehealth, through all these apps, etc. So there's something you could do. You could start a network of all experts, maybe in infectious disease, public health, to give guidance. It's not like the old days where you have to actually travel there or kind of be foot on the ground. There's lots of stuff you could do by telehealth. I apologize about the technology issues. As you guys know, technology is our friend and enemy at the same time. Okay? I wanted to thank you guys for inviting me. I'm so honored to be here. Am I taking questions or just saying thank you, I think, right? If there's any thoughts or questions, you can catch me. My name is Frank LoVecchio. My email is franka, as in apple, LoVecchio, @gmail.com if you have any questions or thoughts.